But I get, by the way, David, I do get, and I've been listening to a lot of GPs, a lot of medical professionals say this time and again, and let's be honest, they can't all be wrong, and it seems completely reasonable. I get that people have been trying to pitch solutions, and I get that they haven't really necessarily been listened to, and that is a fault of our politicians. I do understand that. But do it again now, all right? So come on, pitch me some, right. pitch me some solutions. At least I'm listening.
Okay, well, all right. Well, I think we need to understand that we're in a competitive marketplace in the world. We can't go on relying on taking in doctors and nurses from poorer countries, which has been an absolute plan ever since the NHS started. We've had doctors coming in from poorer countries and nurses, and they're doing a fantastic job. But those countries now need those doctors themselves, and they need those nurses. So we need to have more homegrown doctors and nurses. And that means more medical schools, more nursing schools, and a greater emphasis on training people up to be the doctors and nurses of the future. What about that one?
Yeah, no, I think that's great. I mean, the only counter that I would have is that in a time of crisis, should we be more selfish? Should we be looking to brain drain the best of the medical talent from around the world, as opposed to taking the time to train ourselves? We need GPs now, don't we? We need nurses now. Bring it on, world.
That's where I think that sometime we've got to draw a line. We've got to say, no, we are not going to drain the rest of the world to save the NHS. We can't let countries that have got far more problems than us send us doctors because we pay them more money. We need to make a decision about growing more doctors and nurses in the UK. We've got the medical schools. They're already up and running, but they can't see patients. They can't take in UK doctors at the moment because the government won't let them. So they're charging enormous quantities of money to train doctors for other countries.
Here we go. So this is a key point. So why won't the government let them just throw their doors open? I mean, let's be honest, this country's thrown its doors open in numerous other departments. Why can't we throw our doors open to British citizens who want to train to be GPs and healthcare assistants, etc.?
Thank you. Could you say that frequently and often? That would be great. Look at my down the road where I work. We've got Brunel University. They have a new medical school. And they're not training any UK doctors.
Why?
Because they haven't got the money from the government. And so they're having to survive. They're having to charge foreign medical students coming to this country and getting our fantastic training.